Migration Impact Forum, which is a governmental forum, plus it's made up of representatives from local authorities, from the police, from the Refugee Council, from the trade unions. That is a group that gives advice to ministers about the impact of migrants on public services, and later in the summer they are considering the sort of impact on the health service of migrants. So I'm sort of very happy and pleased to sort of have emails from you after the conference. Please sort of drop me an email if you've got some issues that you would like to see either included in the presentation or sort of really beefed up in the presentation, and I'm sort of then happy to either give you a call back or to sort of talk it through. Thank you.
Some questions.
My question is, when the asylum case is closed, they're not allowed to use the healthcare services. Am I right?
That's what the current court appeal document says, but I'm not sure whether Michael can pick up on that more.
Sure, I'll answer that. I mean, it's sort of almost been that if a person claims asylum, they're entitled to sort of free healthcare. Any existing course of treatment that the person has had while they've been claiming asylum and have had that asylum status, if their asylum claim is refused, that sort of care would continue free of charge.
It certainly puts health professionals and medical consultants in such an awkward position to try and find out who is failed asylum seeker and who is not. But it certainly puts in a very awful position for the failed asylum seeker, refused asylum seeker, to actually come out and then seek medical attention.
As I said, the focus will be on population data, and hopefully we can stimulate a discussion that goes wider than that. But we want to talk through one or two sources of existing information that's relatively easily accessible from national sources. These are, I think, all available from national sources, from national websites and from government departments. The first of those, often referred to as the NINOs, is the national insurance numbers. As you're well aware, when you come into the UK, or if you're a UK national, when you get to a certain age, you are allocated a national insurance number that stays with you, and effectively that means that's a means of ensuring that you're eligible for employment, and if you're eligible for employment, then you're also eligible to pay national insurance. There's quite a useful data set available from the DWP website that takes this national insurance data, the NINO data, and gives you breakdowns by nationality for all the nationalities in the world. So there's a lot of useful information in there. It does have some disadvantages. First of all, it tells you about numbers of people who've registered. It doesn't then tell you about people who've deregistered. So effectively you've got a data set where the numbers are constantly growing. It's nonetheless useful to be able to see what the difference is between this quarter and the previous quarter, and the rate of change over time does tell you quite a lot of useful stuff. It's very limited demographic data. It doesn't tell you, I don't think, anything actually about age or gender or any other sort of demographic variables. It just tells you about the country of origin, and obviously the focus is on employment. This is a data set which was collected for employment issues, and its usability reflects that.
Incubation period is the awkward thing about TB. You can carry TB around in your body for years. And you have a primary infection that's like a heavy cold, clears up shortly afterwards, the bit that is where we diagnose TB is what's called the secondary infection. So it's a little bit like chickenpox and shingles, where you have chickenpox and years later you may or may not get shingles because that virus has been in your body all the time. And chickenpox is not usually a severe illness, but shingles is. Most at risk are the elderly, small children, impaired immune system, and that's not just impaired immune system from HIV/AIDS, even although those two infections coexist in a lot of people, particularly where there's a lot of TB, probably because the HIV actually lowers the immune system. Anyone can have it. Connection between the two. Obviously, you get TB more if you've got HIV, but what isn't commonly known is that in countries where they don't have reliable HIV treatment, if you
be able to phone in to the accompanying service, request an accompanier to go to their client's house, accompany their client on public transport to an arranged appointment, whether it be for health, social, ESOL, women's groups, whatever it is that's going to improve or maintain their mental health. Wait with them during the appointment and then accompany them back to their house again. And we're hoping to do that up to a maximum of 3 times. So we're not encouraging dependency, but we're trying to foster independence and confidence in going out and getting to these places on their own. And that service went live yesterday. So it's a year-long pilot. We've managed to get funding for a year-long pilot, and we're really hoping that if at the end of a year it proves successful, and again, a lot of people are helped, not only to get to appointments, but also into volunteering. It has knock-on effects to employability, which was mentioned earlier, but also just to improve their mental health and make them more a part of Newcastle. Then we will get funded and hopefully roll out this plan to the rest of Newcastle. And at the moment, it's only in the east. And it's for clients who are already in primary care mental health or who are not in primary care mental health but who have a psychological vulnerability such as racism, isolation, all of the things that have been mentioned previously that can affect people of ethnic minority and asylum seekers. So hopefully that's another thing that we've been able to put in place that will help practically people's mental health.
Really, really keen to set up some kind of regional group that is specific for asylum seekers, migrants, refugees and mental health, to take forward some of the key actions that are needed for this region. So if you are interested in getting involved, put your name forward to Mel and she'll keep you in the loop in terms of what's happening with it.
Every PCT, they got a commissioning team central one to looking after the primary care stuff. So they are the one determining on the contract. If you have the issue, talk to the PAL recognize more than 1 or 3, they will discuss with the commissioner. Then they will be used the information they got and then address on the contract when they review it. But without that process, no information come across to the PAL service or then actually they don't have the evidence to prove that I need to do something with it, because the people who work on the ground, up to the ground, they don't know what's going on down to the bottom. Only us, only you work with the patient or the client know what's going on. So you are the one who need to speak up to tell the people what is the need, what's going on out there. If you could, it's part of your role, be advocacy, it's the best thing you can do.
No, I think it's something we really need to do. We really need to kind of look at the commissioning side of things, because that's when we recognise the inequalities. I can see inequalities between areas, just the way we function in people from the conference today. I know that certain people have got dedicated health visitors. I know that other areas have got funding for this, funding for that. And I think sometimes it's about really kind of pushing your message home and applying for that funding and kind of shouting loud enough until somebody listens. That's how we started as a practice at Haven originally. People were complaining, GPs were complaining that asylum seekers were coming to them. They couldn't deal with them. They couldn't deal with the problems in the time. They couldn't access interpreters. And that's how we set up to start with, just on the basis of that. And I think there are lots of other issues and all these different inequalities now between PCTs and between areas that really, if one area has it, we should be shouting louder to get that kind of access for other areas as well. And I think that's something that I will take back from today's conference, really. You know, it's kind of occurred to me today that there are things going on that should be going on in our area and aren't. And I will shout sort of louder about that.